This patient was referred to me for endodontic treatment of tooth number 30, or maybe tooth number 30. Patient's not sure which tooth. Number 30 has a crown on it, gold crown. That patient is very old. Number 31 has a CEREC crown on it, build up as you can see right there. Previous root canal that was done 6 months ago by an endodontist. And patient says 2 months ago he felt some pressure and went and saw his dentist. His dentist examined everything, couldn't find anything. No temperature sensitivity or anything like that. All right, so and then about a month ago, he noticed a blister on his gum that he has been lancing, he called it, for the past month. And the blister, he pokes it, gets rid of it, then he comes back again. The blister comes, so the blister comes and goes. And he went and saw his dentist, and the dentist referred him to us. So I said, why didn't you go back to the endodontist to do the root canal? Not that he would need to do a root canal, redo the root canal unless it's necessary, but why didn't you go back to the, it seems like your dentist has established a relationship with this endodontist because she refers her cases to him. And he said he just didn't want to go because that endodontist was old school. He called it old school because he doesn't have a microscope and he uses everything, he does everything manually, he said. Old school is fine. There's nothing wrong with that. But anyways, he didn't like the fact that he didn't use a microscope when he did the root canal. Not that we don't even know if number 31 is the problem, but he just said he didn't want to go back to that endodontist for even an examination. I said, what was the reason for the root canal on tooth number 31? And he said the reason was that there was temperature sensitivity. When a cold would hit the tooth, he'd be jumping. It was that painful. That's why he got that root canal done. So these are little nuggets of information that you need to collect from the patient. And I asked the patient what was the reason for the endodontist to do the root canal, because then that tells me that, well, if it was a necrotic tooth that needed a root canal, so that means that the necrotic perhaps infected, or was it a vital tooth? And then if it was a vital tooth, then there was no bacteria to begin with. And now if this tooth is indeed the problem, then bacteria somehow got inside of this tooth, inside of the canals. So these are the information, the kind of information that you need. So, and you need to ask the patient all of that stuff. Anyways, when I examined the tooth, number 30 was gold, had a gold crown on it, percussion palpation, cold, all within normal limits. As you can see, radiographs within normal limits. And let me show you. So that's the sinus tract right there, as you can see, is in between, on the lingual side, in between number 30 and 31, right here. So number 31 was slightly tender to percussion and palpation. And then, of course, we probed, and probings were normal. And take a look here. That's I'm tracing the sinus tract. And it's going to number 31. Again, that's my gutta percha. As you can see, it's going to number 31. Number 31 and number 31. Right there. So the problem is tooth number 31. It looks like there's a middle mesial canal there. So I talked to the patient about all of that, his options. Asked him, go back to the endodontist who did the root. Go back to that endodontist who did the root canal. He said, no, I don't want to go back to him. Well, I said, well, you have two options then. One is we redo the root canal and hopefully your infection will go away, no promise or guarantees, you know. Or you can just go ahead and choose to have the tooth extracted. And he said he wanted to go ahead and try to have us redo the root canal for him. And then if it works, great. If it doesn't work, he said he's going to extract it. But this is how you diagnose. It's has to be done thoroughly, has to be done with care. You need to know how to ask the right questions and to collect all of that information and then utilize it to come up with a solid diagnosis. If I couldn't figure out which of these two teeth were the source, if there was that sinus tract wasn't there, I wouldn't have done the root canal or redone the root canal. All right, so I hope these videos help.